Healthcare is changing, and Dr. Nancy RN is here for you. The topics are many, but each program stands on its own with 3 key action points for you to learn. Your guide to a healthier you in a changing world. Dr. Nancy RN.
Welcome to Dr. Nancy RN, Healthy World, Healthy Nation, Healthy You. I'm Nancy Valentine, Ph.D. and registered nurse, and this show is dedicated to you, the healthcare consumer. And we are continuing our program series on autism spectrum disorders. And we have 2 guests that are returning with us that are really powerhouses of information on genetic testing and the interface between that and families, and how families receive this information and use this information. So the title of our show today is Tales from the Hearth, Parents' Stories on what genetic testing means to them as families. And so we're going to be really exploring in this segment what are normal test results and what are abnormal test results, and how to handle both of those pieces of information to your best advantage. So let me introduce our 2 returning guests. I'd like to talk to Dr. Marian Reiff. Dr. Marian Reiff is coming back again. Thank you so much. She is a senior research investigator at the University of Pennsylvania School of Medicine, and she works in the Division of Translational Medicine and Human Genetics. And her partner in crime here is genetic counselor Surabhi Mulchandani. And the 2 of them are really a great pair, because one very focused on science, Surabhi, and Marian very focused on families. And we have seen this dynamic duo before really help us bridge the difference between science and families, and also what is not different, how they really do have to go together in order for your care to be the best. So with that introduction, thank you again for returning and being with us. It's just a delight to see you again.
Thank you for having us.
Yeah, you're welcome. You're welcome. So Marian, since we've learned in previous discussions that this simple test, this so-called simple blood test, which doesn't hurt, is very simple to administer, really can in many ways open Pandora's box for people, in terms of really understanding this is their bodies, this is their genetics, this is what they're made up of. And many of these tests, in fact, the overwhelming number of these tests come back so-called normal. 80% you told us. So when you get 80% in the normal range, what does that mean? And what does it mean when families hear that? Is that a sigh of relief, or is that just the step of trying to learn more? Can you help us with that?
Yes, that was a great introduction to this, because with the families that I have spoken with, many of them do say they were very relieved to get back that normal result, because it rules out a whole host of potential genetic problems that could mean a very difficult life for their child. So first and foremost, yes, it's definitely a relief to get that. The other response to that, sometimes many families say, oh, now I know that my child's autism is not caused by genetics. So maybe it was really caused by something I ate during my pregnancy, or maybe it was really caused by that time when I took an airplane trip and I really shouldn't have done that while I was pregnant, or maybe it was caused during the child's infancy by something he did, some exposure to some environmental toxin. And I'm not saying it's not. I think that many people believe that autism is a multifactorial disease, and that's where we are. It's definitely not all genetic. That's not the whole story. But getting back a normal result doesn't necessarily mean that it's not genetic. And
no,
I think that's something
that would be very confusing to people, because when people hear the word normal, they feel like they're basically off the hook. And like you said, they really respond with relief. But if it's normal and it is something to still be aware of, how do you really translate that?
Well, I think in some of the parents I've spoken with, when they got that normal result, they was like, oh great, it's really not genetic, so we're going to go and have another child now, and we're not worried about having another child that might be affected with autism, whereas we know that it does run in families, and if they are concerned about that, they really need to speak very openly with a genetic counselor about what their recurrence risk might be. And I'm going to let Surabhi answer that because she's our genetic counselor. And just to make clear that a normal result doesn't necessarily mean that the autism is not genetically caused.
Okay, so what does normal really mean? I mean, just the word normal.
Normal just means that this particular test that we did at this particular time did not identify something that is not seen in other people. If the test is evolving every day, the 5 years that I have worked in this particular lab, we have gone through 3 iterations of the same test, and at this point we can find more than the first test would have identified. And it's the technology, but also our knowledge that expanding. So the normal just really is something that's very static to this point, to this particular test. So normal does not mean that the condition that the child is presenting with is not genetic. It really means that this test did not answer it, but there might be another test that may answer it. Maybe today, maybe in 2 years. The only time that a normal result is truly informative is that there is somebody who's affected in the family, and we have a genetic explanation for that family. And then a person wants to have kind of a predictive testing. And at that time, that particular individual does not have the same condition that the affected person has. So at that time is the only time that it is truly normal. But otherwise, at every single time, it just means that your journey hasn't ended. You have to continue to look.
Right.
And a lot of times families are not very concerned. They want to do it just because 10 to 20% of the times we can find an answer and they want to do it. But if it is not, a lot of times developmental delay is just slower development, and a lot of children grow out of it and they are not concerned. So maybe in 2 years they won't be concerned. But for a lot of children, it is a chronic condition and they continue to be affected. We have so many stories as the genetic technology has evolved. People keep coming back every 2 years. Is there something we can do now? And a lot of time we can, and we find answers. So I'm always puzzled when I call out normal result and the family say, oh, okay, we don't have to worry about it. And I'm like, no, you do. I'm not saying that it is something a lot to worry about, but you have to follow up again.
I think that's very fascinating, because I think anybody listening to the word normal is going to feel like, okay, we can move on now. Meaning move on in a good way, like we don't have to worry about this anymore. So really, to just reiterate what Surabhi just told us, is that it may be that we are suffering from the fact that the test is not sensitive enough. So as the technology she's explaining to us gets more sophisticated, it can be more powerful in really finding things that it couldn't find a couple of years ago. And we have learned through other discussions how rapidly this technology is trailblazing. It's just amazing how in a very short period of few years, how things have really ramped up in a very powerful way. It's really hard to believe how much more sensitive things can be even a couple of years from now. I think the other thing that she is saying is that if you have a child, for instance, who has autism, and you want to have it, and you do have a second child, maybe you would want to have this test done because it would be able to predict at a very early age of this second child whether this child is going to potentially have autism. Isn't that what you just told us?
Right. When you have an answer for when you have an explanation for the first child, doing this test for the second child, it is hugely, hugely helpful.
So I think in that case, normal is really a green light.
Yes, absolutely.
I think that's really an important differentiation to make, because many people have children after they have an autistic child. And maybe if they had children rapidly, many of these children cannot be diagnosed in 6 months. I mean, it's really a little bit later that they start exhibiting those behaviors that then become suspicious. Maybe you've had another child since then. And so that child could be tested, and that's really where this test can be very powerful. But it can be powerful for anyone, even if it comes back as normal. But it's again in that fine and important discussion that the team has to have with families, so that they understand that they haven't just done this test and it's not worth anything, that it's really a piece of a much broader puzzle.
Right.
They may, if the child has very unusual symptoms and behaviors, and you get this test back that says normal, it doesn't mean that the child is not going to still progress in their illness.
Right. Right.
But if nothing else, you are not only learning for your own family and your own information, but you are helping literally to be a scientist yourself, because you are helping by giving that DNA material over to the scientists and the people that are working on these teams so that they have more material to do this mapping. It is so complicated in terms of how this really works, and this learning curve that everyone is on to try and map is very early. I mean, 10, 20 years from now, this will look like the Stone Age. But right now, we're in the Stone Age, and we're trying to get those two sticks together to make fire. And you are a part of that equation, and I think that's really very optimistic. It's not necessarily what's going to fuel people to do this right off the bat. They're very much more interested in their own child and their own situation. But they should know that they're also contributors, and I think that's really important to emphasize, that you as a consumer do play a very significant role in this.
And as you said, that you become scientist, and we see that not in the normal result situation, but when we have abnormal results, because these are such rare conditions that in general the families have so much more information about it than every other pediatrician or the teachers that they go and talk to. So you have to become the educator and advocate for your child.
Right.
And you do become like a scientist. It's amazing how much these families learn, and the more they learn, the more they can help their children, and it's just heartwarming to see how they all come through such.
Right. And I really want to make it very clear to our listeners that these things can be learned by anyone.
Absolutely.
Even though it is very complicated, and we do have a lot of scientists at the bench, so to speak, working on this, you can really understand that. And that is the purpose of this and other shows that are related to this, so that it really is boiled down to the point where we haven't oversimplified it so it doesn't make any sense, but we've brought it down to size so that you can really act on this. You can use this information in very positive ways. Now let's turn our attention from those that are normal. That's complicated enough. But I have learned from our guests that 80% that come back normal, that's this whole category that we just touched on. Another 10% are maybes, and then another 10% are really more definitive, meaning they are clearly abnormal. And maybe you could tell us about that.
Well, maybe we should use an example to illustrate how that really helps. So one of the examples, that has stayed with me even after 10,000 patients really was this child. So she was 4 or 5 years of age, and she comes in, and the reason for testing for this person was that she had autism spectrum disorder, she had developmental delay, speech more delayed than motor, and these are just the things that people think about to understand where could it all have started. When you think about speech delays, a lot of things that we want to rule out is really hearing loss, which is very, very common. So to know that the delays were motor and speech, that gave us some clue about that this could really be genetic, and then she had behavioral features that were going on with her, and we did this testing on this little girl, and you're going to see a visual aid, and that would illustrate what did we find on her. And I know that this looks complicated, but we can all understand it. So
it's very pretty. I mean, lots of great colors. So tell us, what we're looking at and why it has color.
Okay, so we are looking at 2 panels here, left and the right panel. And left panel is showing us a pair of chromosome 7. And just to recap from a couple of shows ago when we were talking about genetics, so each one of us has a genetic blueprint, or the DNA, in chromosomes, and each cell of our body has 2 sets of 23 chromosomes. Now these chromosomes are numbered 1 to 22, and the last pair is the sex chromosome pair. So what we are looking in this picture is a chromosome pair that's labeled as number 7, and that is because of the size and this pattern that we are looking. So when we started recognizing all these chromosomes one apart from another was because of these patterns, and you could see that under the microscope. And what we did and what we recognized that each chromosome looked like it had 2 arms. One was small and the other one was big. So the small arm was called petite, and the other arm, or P for petite, and the other arm was the Q. And nerdy scientists came up with some other explanation, but I think this helps us remember what that means. And then there are all these different dark and light bands on there, and those really are like the house numbers, all these addresses. So what is colored in orange in the left panel on this chromosome, the long arm of chromosome? So the long arm is Q. So how we really have labeled that it is chromosome 7. Now the color is on the arm Q, which is the longer arm, and then really the address is 11.23. So that's just, you're going down and then you're giving it numbers to those bands. So what we identified in this little girl was that on one of her chromosomes, she had 2 of these addresses. So the part Q11.23, instead of having 1 piece, she had 2 of those, and that's what we call a duplication. So in general, you should have 2, and she had 3. And this part, this tiny little part that we see here, actually has 25 genes within it. And I'm sorry. At this point, we knew that duplication is seen with individuals with autism spectrum disorder, and it does almost always result in speech delays and speech apraxia, which is the problem with the movement of making sound.
So this is a really dramatic example of where you could really zoom right in, really with electron microscopes, really looking at that tiny, tiny piece of genetic material and say, here it is, we can see it.
Right.
So it's amazing because when it works, it really works because they've mapped that piece of it. The rest of it is still sort of out there. We're not really sure. It will be mapped in time. But that's pretty dramatic. So in this case, with this particular patient, you were able to see her behavior, and then you could find why, the explanation as to why.
Yeah, we could give explanation, and the next step that we do for all of these is do parental testing, which helps in really, if the parent has it, comparing the features between the child and the parent and kind of giving some idea what to expect in life, and B, if the parent has it, what are the chances of it occurring again. So in this case, we obtain parental sample when mother has the same duplication.
So in this case, if they were to decide to have another child, their chances would be very high.
The chances would be 50% because we have 2 chromosomes, so she has 2 chromosomes 7, and there is a duplication on one and not on the other one, and her chances of passing it on to the next person, she could pass it on either of them, so the chances of it occurring again was 50% in this condition. And that's not the same for all genetic conditions. The chances are 25% in some, 50% in some, but really the highest is 50%, which is for this family.
Right. So let's cross over. That's an excellent case because when you have those kind of cases, you really feel like you have a breakthrough. But the question is, what do people do with that? I mean, it's like, okay, we already know we have a problem child because we can see it with our own eyes, and we've had it validated by clinicians. Now you're telling us with the science that, you can really see that address, so to speak, and trace it. That's very interesting from a scientific perspective, but how about from a humanistic perspective?
Yeah, I think that's a great question. And I think so we'll talk about this, this family. The first response is, wow, we know what's causing this. That's great. And we don't have to look anymore, because often they're on what's called the diagnostic odyssey, which is they're looking and looking and looking for a reason. They can say, oh, it wasn't that, hamburger I ate when I was pregnant. It was all along, it was genetic. So there's a great deal of relief, alleviation of blaming oneself for something that you may have done to cause this. Many parents go through that. So this offers that relief to parents. And secondly, it also provides some medical benefit because we know that this duplication is connected with other medical conditions that could occur later in life.
Such as
Kidney problems, heart problems, eye problems. So we know that we need to refer this little girl to specialists
Right.
to have some kind of screening throughout her life just to make sure and keep on top of that. And it can really prevent further diseases from
Right.
from occurring if she has the right kind of treatment. So that's huge.
That is huge. But let me just stop there because I can think of some people just saying, that's too much bad news for me. I don't want to necessarily know that. What I'm dealing with right now is hard enough to think that we're going to have further complications. But I think it's the way it's presented, the way, I liked what you said about prevention. See, it's really good news in the whole scheme of things because it gives some time to work on the plan. It's a difficult plan. It is definitely a difficult and challenging journey. But by having that predictability is more than what most people have.
Yeah.
Most people don't know when they're going to have heart conditions or cancer. In this case, you would have a bit of a running start.
And what you say is really true. One of the moms said to me, you know, getting this test result was a huge, significant event. It was the best and it was the worst. So it is both. And it can be the worst because it can say, well, this child does have something that is going to be with them for the rest of their lives. That is very difficult for some parents to accept, but it also helped some parents. That acceptance helps some parents to then say, well, what can we really expect? What's realistic? And where should we put our energies?
Right.
So we're not going to stop interventions. We're not going to stop early interventions. We're still going to put as much energy as we can into therapies for that child. But maybe we want to focus more on teaching a child sign language rather than trying to teach them speech if they have certain biological reasons why speech might not be appropriate.
I think that's really an important point, and probably this is just one of many examples. The question is, everybody only has so much resource, so much energy, so much money, so much time, whatever your resource calculation may include. And you don't want to be going down a path for which there's very little return. And to know in that case with this particular speech difficulty that can be mapped physiologically, to understand that the speech will not improve because it's genetically coded. It cannot be changed. It's throughout every gene of their being, and so therefore it is what it is. But that sign language would be a very good thing to invest time, energy, and resources into because it really gives an alternative. I think that's an excellent example of how a plan can really work for people. There's so many overwhelming variables that what I think we're searching for using science as much as we can is let's give people guidance and direction for things that are going to work, that are really going to have payback. Is that what you're finding with the families?
Well, I think for some of them, yes, and I think it takes some time. So I think the first reaction to some of this news is it's very difficult to bear this burden. But over time, I think people adjust to it, and then they can maybe feel the benefits of it more. And I think that what we're also seeing is with some of the parents getting tested themselves, it's a double-edged sword. It's information, and you can take information either way. It can be beneficial and it can be harmful. And so I think in a case like this, the mother had this similar duplication. She had no idea she had this, and she'd been through her life and had no idea that she didn't consider herself autistic. So I think this is something else to remember, that the severity of the problem, it might be genetic, but it might be very mild in one person and very severe in another, and they may carry the same gene. We don't know yet why that is.
That's a very dramatic example, that the mother who never really ever felt she had any of these symptoms, even at the mildest level.
Well, she hadn't recognized it. So once it came back and they say, oh, you have this too, then she said, well, I didn't get any interventions when I was at school, but I did have some problems.
Such
And
as, can you, just as an example?
Some social problems, interacting with other children, speech delays.
She definitely had speech problems, and she did not. She did not get therapy when she was. When she was little.
And you know, we're in a different day and age now where therapies are much more available. But many parents come back and they're very surprised that they have the same thing, and it does excite. Oh, is that why? I dropped out of high school and I wasn't really able to continue, and it suddenly things fall into place for them.
Right.
Other parents are concerned. They might be very high-functioning people, very smart, physically high-functioning. They discover that they have a genetic deletion or duplication, and they doubt themselves. So it's not that there's really any reason to, but just knowing that you have this, it can change people's sense of identity, their self-concept. They can worry that they might be discriminated against for having this. So it's very important to discuss all these issues, I think.
There are a lot of ethical dimensions to all this, and how the information is used. And the information can be used in a very powerful and very positive way. It could also be potentially harmful. But what is very fascinating about that particular case is that the same duplication of this genetic change in the child had a much more dramatic impact. So it may be, again, it just points to those other factors, whatever they may be, or other genetic changes that just were not captured, that maybe were sort of filtered through and came back as normal. But there are other variations that made that second generation change more dramatic.
Absolutely, that's definitely possible. And we have been talking so much about what it may mean to different people. And, you know, some people really try to focus on the positives, and for some people it's really the stumbling block. But when you talk to the providers, there's always information available, interventions available that could help you get through those stumbling blocks. Like getting intervention, any kind of therapy becomes so much more easier once you have a diagnosis, and that's just interesting to me that you know, we would write a letter and say this is what's going on, this is expected, and then the child suddenly gets so much help and is doing much better than they had before. So recognizing that there is, even if there is uncertainty, even if there is all these changes and challenges, there's stuff that you could still do with that information.
Well, I think that what we're learning is awareness of autism is really just the first step. There are many other steps and things that you can do with that. I mean, for people that are affected by this in a very direct way, or if you're a part of a family where you have a child that has autism, there are really good steps that you can take that really can help to inform that person and give them a better life overall. So I just want to say that this has been a really wonderful segment in this discussion, because it really does give us some of the facts related to genetic testing and some of the new horizons that are out there. But I think what really comes through is the courage that it takes for people that are facing this to really take that next step, to have that simple blood test that, as I said earlier, really does open up Pandora's box of new information and new things to sort through, the complexities of it, as well as the good news that can come out of it, as we've referenced in some of these case examples. The world is changing, and is changing by and large for the good, because as we move through this, and each person that's involved does play a very significant role, and the courage that it takes to receive that news, the courage that it takes to process it, really is a major step for these families. And I want to thank the expertise of Surabhi and for Marian, working as a team. You can see, with all due respect for science, and I think it's wonderful, it's really power to the people. It's really those tales from the hearth. They are keeping track of people's life experiences every bit as carefully as they are keeping track of the science of your genes. And I think that's really important to take away from this show. You can't have one without the other. Otherwise, it's not going to take you to the levels that you really need to go. So again, I want to thank our guests for really educating us on a complicated topic and making it something that we can take and use for ourselves or for others that we know. I hope in some way you can play a role to help people with autism, that you can do something significant to really make their life better. So thank you for being with us today with our show. And I hope you will join us again soon. And in the meantime, remember, with health, all things are possible. Have a wonderful day. I hope you enjoyed our conversation today and that the information will help you in meeting your health goals. Catch this program and other conversations on the website, drnancyrn.com. Or you can write to me as well. I welcome your comments and feedback. Thank you for listening and join us again. And remember, with health, all things are possible.